While new confirmed cases are dropping in China, the novel coronavirus continued its spread on a global scale, with cases surging in countries such as South Korea, Italy, and Iran. How serious is the threat for a global pandemic? How can the risk of cross-infection be minimized? How far are we from effective medicines and a potential vaccine? And in what ways can technology help fight new diseases like the novel coronavirus? To talk about these issues and more, I'm joined by Dr. Hong Yin, Dr. Le Yao Wang, both from Washington University in St. Louis, and Professor Jeffrey Sharman from Columbia University in New York, and Dr. James Jianho from Tsinghua University Healthcare Industry Research Center in Beijing. That is our topic. This is Dialogue. I'm Zhou Yue. So let me start with China. The WHO has just wrapped up its investigation here in China, and their conclusion is that the disease can be contained, and China's responses to the outbreak have yielded notable results. And they say China's response is ambitious and agile. So Professor Sharman, what do you think of WHO's assessment?
Well, personally, I think that what the Chinese government and people have accomplished in curtailing the virus is really remarkable. We haven't seen that kind of reduction in a respiratory virus transmission event like this ever, and certainly not at the scale and not with bending it around the curve so that you don't have this explosive epidemic. That said, I'm personally not as optimistic as the WHO is, simply because the virus is outside of China as well. And the Chinese government's not going to be able to enforce the measures that they've imposed domestically, internationally. It's really spreading very aggressively in Korea, Iran, and Italy, and I believe it will be spreading in many other countries similarly. And once China has to go back to and return to normal economic activity of some sort, the virus is going to be reintroduced. And that's the big problem.
So you're saying the temporary decline of infection growth may not remain.
Yeah, I mean, the question is, how long can you keep these measures in place that are effectively curtailing the transmission? It appears that much of the transmission is supported by undocumented cases. In other words, infections that are of milder symptoms who are not seeking clinical care. And in other countries, these are the people who are probably facilitating the aggressive spread. That's what probably allowed the virus to spread so quickly in China. So the question you have to ask is, what is the end game of the types of measures that have been put in place within China? They can forestall the outbreaks there, but ultimately you're really holding out for the development of more advanced and better therapeutics or a vaccine, because the virus will return once international trade and commerce return to China.
But China's experience saying that we keep people at home for self-isolation, waiting out the incubation period. When there are symptoms, they will go to hospitals for care. Why that experience can't be copied elsewhere?
Well, you know, the thing is how well you can actually enforce the compliance of that. And that's the thing that we would have to see. If we can see that countries such as Korea and Italy and Iran are able to effect the same measures that China has, then there might be some chance of doing it. But it's already spread to dozens of other countries, and as it spreads worldwide, the question is every country really going to have the wherewithal and the means to actually enforce that kind of containment? And particularly in the developing world, this may be very challenging, and it may just spread there and seed the other portions of the world.
And earlier you mentioned some patients may not show symptoms, but they can be contagious. Do you believe this is the main transmission route in China and elsewhere as well?
I do. We ourselves have a study of this where we performed a modeling study and inference to try to estimate the fraction of people in China prior to the travel restrictions on January 23rd who were not being documented, and also the contagiousness on a per-person basis of those people. And we found that about 87% of people were undocumented at that time, and that's how the virus would move through another population in a developed world country prior to any containment efforts. And that those people were quite contagious, not as much so as the very severe cases going into hospitals, but they were indeed quite contagious.
Dr. Wang,
we think that's...
Yeah. Dr. Wang, I want you to weigh in on this because earlier scientists believe this virus is transmitted through droplets when people cough or sneeze. But now we found that it can be airborne, and also viruses were found in urines and feces of patients. So what do you think is the main transmission route?
So there is no direct evidence connecting the expansion of the transmission modes with the viral evolution. In fact, comparing the over 100 genomes of the virus from different countries and time, we don't identify any significant variations.
The virus hasn't mutated in different places around the world. So that should be a good news.
Yes. Yes, that's a good news. And also I want to add something on the transmission routes. As we know, right now we are have more information on the virus. So the increase of the transmission modes actually suggests or reflects that we are learning about these viruses. It's not necessarily indicating the virus is rapidly revolution. And I think I would say this is not a big jump for a virus to transmit through the sneezing, coughing, or close contact to the transmission routes of air or touching, because it's all about how long the virus can be viable outside the human bodies. For example, if a virus can keep their viability in the air or on the surface for hours or days, it greatly increased the chance of infection through the air or on the contacted surfaces. So this is not a big jump. Regarding the transmission mode of fecal-oral transmission, there's no adequate evidence showing this transmission road. We need more studies to confirm this. Right now, the assumption is only based on that we identified some viral particles in the fecal samples of several patients.
Professor Sharman, could you please explain it to me why it took the virus only a month to travel to all the continents in the world, probably except Antarctica? Does it mean it's very contagious or people are underprepared?
It actually means that, again, I think it's these undocumented cases. There are lots of people going around. If the majority of people who are infected are only suffering mild symptoms, they don't stop traveling, they don't stop going to work and going to school. And as a consequence, they're going to get on airplanes, they're going to get on trains, and they're going to travel long distances with the virus. But if they're shedding, if they are contagious while they are not manifesting many symptoms, that is particularly problematic. Now, we have seen this in our own active sampling here in New York City with other seasonal coronaviruses, including beta coronaviruses, and this is a beta coronavirus. And so you have two ends of the spectrum. SARS, which emerged in the late 90s, that virus really was almost all infections were symptomatic and documented. It had a very low rate of undocumented infections. The ascertainment rate was very high. In other instances of seasonal flu, it's very low. Most people have mild infections, and these seasonal coronaviruses, things like NL63 and OC43, they spread very efficiently because most people just go about their business while they have a little bit of a sniffle and they pass it along. So this one seems to lie somewhere in the middle.
Isn't a very typical coronavirus. It's more like the flu virus.
Absolutely. It is behaving more like the flu. And the reason why the flu can spread so efficiently is because of these undocumented cases. The fact is that with a good flu, well, not a good flu, with a bad flu, you're going to have maybe 1 in 5 people seeking medical treatment, and a lot of other people are going to have milder symptoms, and they're still going to be contagious, and they facilitate the transmission of the virus.
But the problem is
this coronavirus is aligned to.
But the problem is this mortality rate is much higher than even a bad flu. The mortality rate now stands probably at 2 to 3%, and the flu is probably 0.1%. So if it can spread like a flu, that will be a lot of casualties.
That's right. And so what we're looking at is, you know, you have to look at historic flu pandemics to get some some bearings on it. The 2009 pandemic had a very low case fatality rate, was very mild. Obviously, the other N members, 1918, that had about a 2.5% case fatality rate, but it probably had a lower rate of asymptomatic infection. This one, because it's got a higher rate of asymptomatic infection, or about the same case fatality rate, honestly, we're looking at an upper bound of about 10 to 11 million people potentially dying over the next 2 years if this spreads as it has, and 50% of the world's population is infected within 2 years, which is a rule of thumb. Now, I don't mean to fearmonger, because there are a lot of things over the span of 2 years that can happen to change that. We can improve our therapeutics, we can develop new ones, we can develop and enroll a vaccine. Those are the critical things that are going to really be needed, I believe, if we're going to reduce the mortality that I'm kind of expecting to see.
And Dr. Wang, this is a worse scenario if this virus cannot be contained, that people have to cope with like a flu. But I want your take on the mortality rate of this virus. It seems to be 2 to 3%, but in Wuhan it's particularly high, more than 4%. Why there is a gap of mortality rate in Wuhan and elsewhere?
I think the straining of the medical resources is the major reasons underlying this high mortality rate only in Wuhan. We expect to see a dramatic drop of the mortality rate in Wuhan after we get more medical teams, emergency equipment, and less cases, and also we use the 2 major emergency hospitals. We should expect the drop of the mortality rate.
And Dr. Yin, I want your take on Wuhan's response to the surge of patients. Dr. Wang mentioned China built 2 hospitals, special hospitals to deal with the epidemic, and also added tens of thousands of beds in gymnasiums and convention centers. What is your assessment of the response?
So in the past, our urban disasters responding system was mainly focused on the natural hazards, firefighting, and wars. So the Chinese city is normally the high population densities. So the temporary quarantine hospital like the Fangcang Hospital in Wuhan has a high risk airborne contamination to the surrounding neighborhoods. So from urban design and architect perspective, the size, the supporting facilities for the neighborhood, and also the border control are critical related to the quality of life and the well-being of the people. So urban designer and architects should closely coordinate with the environmental engineers and medical doctors to mitigate the potential airborne and other medium infectious diseases in this high-density urban context.
So you're saying those 2 special hospitals posed environmental dangers because they can send out viruses in the open. And you actually put up a plan there to avoid that from happening. What is that?
Exactly. Actually, once a lot of people, thousands of these patients together, the concentration of this active virus is going to be high. So we, 4 of scientists from Washington University in St. Louis, Purdue University, and also Oak Ridge National Laboratories, we put forward together the concept of high temperature virus inactivation approach. We try to heat the indoor exhaust to 100 Celsius to inactive coronavirus concentration to 99.999%. So the heated exhaust air from the hospital can be used to preheat the cold exhaust air before it enters the combustion furnace. So in this method, we can minimize the possibility of contamination in the high-density community around the Fangcang Hospital.
But is it also cost-effective because you want to put those sterilization programs in makeshift hospitals? How long does it take? How much does it take?
Yes, we studied this. This all standard products available in the market. It's basically it's an air-to-air recuperator for standard boiler system. So it's quite cost effective, and but right now for the emergency, we have to be coordinated with the city to make this happen available. Or for long term, we're hoping we can prepare this strategically for future emergency situations.
And Dr. Yin, obviously, this is a shock to the infrastructure, healthcare infrastructure in Wuhan. And what is your suggestions to cities, not just in China, but everywhere in the world, in terms of preparedness of public infrastructure to deal with a crisis like this?
Well, it's a good question. So normally in China, this time during the virus outbreaks, so in academia, many scholars have proposed innovative ways to deal with the future epidemic crisis. For example, Professor Dongqing Han of Southeast University and his team developed in 15 days a design guideline for transforming a gym into a temporary medical center. I have here with a picture with me. So this is their plan how to transform a gym. In another case, Professor Lan Wang from Tongji University, she also put together an innovative planning concept. It's called the public health units. So I have a picture here. Also shows very interesting diagram. So basically, she's trying to prevent and control the infectious disease through three measures: isolating the source of infection, cutting off the transmission route, and protect vulnerable groups. And another IPPR team developed the design standard for infectious disease emergency medical facilities. So many scholars and medical service providers in China and the United States are working diligently to carry out this basic research to learn more about coronavirus. And we are racing against the virus, so the brave will prevail.
And before I let you go, Professor Sharman, I understand there is a new reported case in California where people don't know why he got infected. How are you worried about the spread of the disease in America?
I certainly am worried about it. I don't think there's a portion of the world that's really exempt from having to contend with this virus. I really think it was just a matter of time before something like what was been reported in California was reported. And the question is, how quickly will it spread through the U.S.? What kind of measures will we be able to effect to control it? Can we do something as successful as the Chinese? And how well are we going to be able to deliver care to the many people who are probably going to be coming to hospitals as our systems are overwhelmed and we have to adapt some of the practices in the emergency medical responses, including some of the things that Dr. Yin was talking about just now.
All right. Thank you very much. We'll take a short break, and we'll be back in a short while. And now I'm joined by James Jen Ho from Tsinghua University Healthcare Industry Research Center in Beijing. So Dr. Ho, I guess you have kept a close watch on what is happening with the coronavirus. It seems that it is traveling faster than we think all over the world. And people worry it might become a pandemic. What is your thoughts?
It is spreading faster than we thought. And as far as I know, that we have not figured out how this virus why they spread so fast. So I have a very strong concern about the spreading throughout the globe.
And I understand that people already relied on technologies and to aid our healthcare workers in the fight against the coronavirus. For example, they use robots to provide care and also keep track of those patients' movement with big data. What do you think is the role of technology in trying to ring in an epidemic like this one?
I have seen so many different technologies being used in this past weeks. it's amazing that people are so creative, try to stop the virus from spreading. For example, in Tsinghua University, we have developed some technologies to prevent the virus to infect people. For example, that we have developed a ozone cabinet, try to disinfect the clothes, the face masks, all that. There are other technologies that we have seen, like online consultation, try to give people more advices on how to prevent from getting the virus.
And can you give us examples that technologies like that can really help those doctors and nurses in treating patients or getting workload a little bit easier?
You know, we're all kind of afraid of being infected because the virus can be anywhere from aerosol or from droplets, or maybe from you touching the surface. One thing that we can do, and now I think we can do it very, very well, is try to clean up your clothes. Anywhere you go to, your clothes can be infected. You can contact some virus because you touch it. Like the gloves, the facial masks is another one that we should clean it up. Your cell phone surface, you should clean it up every day. Whenever you go home, you better put that into a what we call ozone cabinet to get disinfected. On the other side, on the treatment side, there are lots of new technology being used, not just drug itself. We try to help people to boost the immunity. Now, traditional Chinese medicine has been applied to many patients, and they turns out to be very effective.
And also big data. I was told that some of the tracking and monitoring devices are using big data technologies to know the whereabouts of those who have a high probability of carrying virus or becoming infectious. What can you tell us on that?
Well, I'm not an expert on that, but from what I read, I think the big data so far are really taking lots of advantage of you know, the tracking information that we're collecting, you know, from where people goes and where people who contact who, that kind of information all being collected. So the technology can be used to analyze those data and come up with some results to help authorities to make some decisions.
Because the outbreak of the novel coronavirus, a lot of people are doing soul searching on what went wrong with China's disease control system. Can you share with us some of your thoughts why the monitoring system didn't kick in earlier?
Well, that can be a very complicated answer. But one thing, we have to blame the virus itself because this virus is so different from what we have seen before. We thought it was like a SARS, but it turns out to be not exactly. So it's very difficult to find them. And that's one side of the problem that we're facing.
So you're saying
on the other hand,
virus itself
yes,
poses a challenge to the disease monitoring system that we already have in place?
Well, yes, of course. But I'm sure there are lots of measures being taken. But still, there are got to be a lot of area to be improved. I'm sure that after this whole epidemic, our system will have lots of to rethink what we should do better.
And earlier, I talked with two doctors from St. Louis about the preparedness of public health facilities in China. What is your assessment of the healthcare services in big cities like Wuhan? Because obviously, Wuhan had been overwhelmed by the sudden surge of demands. But should we provide some spare capabilities in order to cope with sudden outbreak of a disease like this?
Yes. When we think about the healthcare system we have in a city like Wuhan, they already have a lot more than the average cities in the country. But even that, when we're facing such a dangerous virus infections, we don't think that we have enough resources. So that definitely poses a very challenging thing to our system.
And in terms of management of such an outbreak of epidemic, people blame that maybe the country's disease control system should have a better say in policies of epidemic control. What is your take?
Well, I think for any kind of policies, especially to do with such a more, I guess, more scientific type of decisions, we should have the experts involved.
Yes, we should have experts involved, but the problem is how much say do they have? Probably they have to report to the local health authorities and they have to report to higher authorities, and that might delay the response time.
Well, that's another very complicated issue. You know, who to report to whom, how the system functions more effectively. I think this should be something we do more research after this.
And what is your estimate of how we can wrap up this round of epidemic? Of course, we have seen the new infection cases rise and slow down, but people still say that we should guard against any complacency. This is far from over. What is your take?
Wow, this is very, very difficult to say. Well, certainly we all hope that we get over this as soon as possible. But as we see more, less and less new cases, we are very happy to see all the measures that we have taken is taking effect. I expect that this will continue going down and it will be over very soon.
Okay, let's hope so, and best of luck to this country and the people. Thank you very much, Dr. Ho.
Thank you.
And you've been watching Dialogue here on CGTN. I'm Joe in Beijing. Thank you so much for watching.